it's Dr. Pat with Little Critters, and we have Jimmy here, a 5-year-old guinea pig, and he's very happily eating a pellet right now, so I don't want to interfere with that. Jimmy presented today for a number of concerns that his owner has. One of the concerns was she feels like he's having a little more difficulty walking with his pelvic limbs or back legs, and he will occasionally stumble and fall to the side, to both sides. He also has had a reduced appetite, which he's not showing us right now, and reduced fecal output. She's also noticed coughing with Jimmy, a number of things going on. On the physical exam, can't see it because of the fuzz, and this is an important reminder, but when we actually palpate him, he's actually very thin, and he has free access to food. We can palpate all of the spine, all of the ribs, the pelvic bones are very pronounced here. He has a number of concerns. One of the things we worry about with a coughing guinea pig is pneumonia and heart disease. I see both of those very commonly in guinea pigs. The things that I would think about, or the concerns with him walking and sometimes falling and stumbling, would be osteoarthritis. You can get both a septic or infectious arthritis. I've seen it in the hips and knees very commonly, and regular kind of wear and tear arthritis as well. The stumbling and falling may indicate that we actually have a balance or a neurologic condition. He does not show a head tilt or other overt neurologic signs, but that would also be a concern. And with respiratory infections, we often get inner ear infections, and that can cause some balance loss. A number of concerns there. The other thing we noted, when we palpate his abdomen, kind of mid-abdomen here, there is a palpable mass in this area, and it is fairly firm. It's non-painful on palpation. Quite a lot going on with this little man, and obviously we're very concerned about the potential for a mass. Masses can be a number of things as well. So you could have an obstruction in there. Cancer is the biggest concern. Organomegaly, or just organs that are enlarged, from a number of causes. The plan for Jimmy is to get some radiographs, and we're basically doing head to tail. We're going to make sure we get radiographs of the inner ear. You can actually see pus inside the inner ear on a radiograph quite cleanly and clearly. We're going to look at that. We're going to x-ray the heart and lungs to see if the heart's enlarged or if we have pneumonia in the lungs. And then we're also going to do the abdomen to look at the mass and get the pelvic limbs, hips, and knees. We're starting with that, as well as a CBC and chemistry, so blood work to see what the organs are doing, the red cells and the white cells. So it's really a screen to try to narrow down all these possibilities, and we'll update you as we get those diagnostic results.